All right, welcome back to the Tim Teaches podcast. I'm your host, Tim McCoy. Today, I'm thrilled to introduce to you Dr. Evelyn Higgins, a pioneer in the field of addiction and recovery and holistic wellness. With over 36 years of clinical experience, Dr. Higgins is the founder of Wired for Addiction and Wired BioHealth. Dr. Higgins, you have worked with everybody from the U.S. Surgeon General's office to the 1996 Olympic team doctor. You focus on epigenetics, mental health, and addiction recovery, all of which have a little bit of experience with the mental health side, so, like everybody. So I'm excited. Thank you so much for joining me. If you would introduce yourself.
Oh, it's my pleasure, Tim. I'm really looking forward to your podcast. Been in practice for 36 years. Kind of the background was in the area of physical medicine, pain medicine, and practicing initially in a rural area and seeing people becoming dependent. This is that long ago. And then that moved from dependency to addiction and kind of needed to add that whole addiction mental health component to what I was doing, because in a rural area, it's like a one-stop shop kind of thing. There's not resources for everybody. And then after that, I moved like 20 years after, I moved to an urban area, but I didn't see anything different. It was the exact same pattern, exact same behaviors. So that was kind of the professional end of things. Personally, I married a man who was an alcoholic, really several addictions. And we had a child together. A year after she was born, we found out he was adopted. Knew nothing of his health history, and I was seeing behaviors in him that I had concerns for. Like, what do I need to know? What do I need to look out for? So kind of that was how that segue happened some 18 years ago, of saying what's available as far as technology and diagnostics for mental health, for addiction, and really for wellness. And the beginning of it was looking at neurotransmitters, brain chemicals, and hormones, how those interact. And then it was only in 2015, 16 that the ability to look at what we call genetic SNPs, or single nucleotide polymorphisms, became available. Polymorphism, just an error in your genetic coding. Sometimes it makes a big issue, sometimes it's really nothing. But we put all that together in the perfect world to have someone look at all these things before you find yourself really saying, what's going on with me? What do I need to know? And then you get into that merry-go-round of try this, half this, double that. And we see so many people, Tim, that's their story. It's like, yeah, I've not for lack of trying, but we didn't get anywhere.
Yeah, that was my story. I'm a veteran, and so I went out to the VA after my time in Iraq, and they gave me this and this and this and this, and it just nothing helped. And it was just like up the dose, try a different medication, and and unfortunately, that's kind of the avenue. I mean, they're overwhelmed, and so there's not a lot of options for them. So
exactly, we actually see a lot of vets, and thank you for your service. But it's the same story with everybody, went for help, and that takes a lot. You can speak to that. It takes a lot to get to the point of, I'm going to reach out and ask for help. A lot of guys don't, a lot of people don't. So to get to that point, and then, as you said, they're so overworked at the VA, and it's very government-esque, where we're not going to employ anything new. We're going to keep on doing the same thing over and over again, although it doesn't work. Definition of insanity, right? But we're just going to keep on doing, because that's our machine, and we're going to keep the machine the way it is. And we had a lot of people come to us like, it's not working. They'll give me every script I want. In fact, I talked to one fellow who was on 19 different scripts and still going nowhere fast. So it's give you. But it's like, for what reason? We're throwing a dart, hoping we get somewhere close to the problem. And that makes absolutely no sense.
Yeah, it's crazy. I mean, I was on 4 different medications at one time. It's like, do these doctors even understand how these medications interact truly with each other? And the answer is probably no.
Yeah.
So on the epigenetic side of things, your testing people's genetics and kind of it's printing out their DNA, and that's helping people understand the what they're predisposed to.
Great point. So epigenetics, to me, the most fascinating part of science that exists today, because we can change the outcome, right? So genetics, you're born with your DNA. Here's your cards, play them out, right? Epigenetics, we now know that the expression of those genes is what can change. So that can give the power back to the individual, right? So, but we have to know what it is. We can't be guessing, hey, and what, up to this point, what we had was, well, I've seen this behavior in my mom and dad and my grandparents. I've got some aunts and uncles, and that was all we had to work with. But now, and here's the thing, Tim, 8 billion people in the world with 8 billion different sets of DNA. Yet we treat everybody like they're exactly the same.
Yeah.
And then we wonder why we don't get the results we should get. So we do a simple buccal swab. We learn this is you. This is where these polymorphisms or these errors exist. Okay. What do we need to do to optimize those biochemical pathways to get you the best you can be? And perfect world, this is all done before we run into the roadblock, right? So we already have a game plan in place. I can't tell you the amount of people where, and a parent will say to me, my daughter's now 21. For 20 years, I never saw this behavior in her. And then all of a sudden, it's like a different kid is showing up. I'm like, okay, what happened over this last year? Tell me what's gone on in her. Well, she went away to college. She's responsible for herself for the first time. She's making her own decisions. She's trying to do school. She's trying to work a part-time job. She's got all new friends, in college life, probably not sleeping. Probably chances are you're partying, So it's like all of these things have changed in your life. Your environment has totally changed. So what was always there is now showing up saying, hey, I'm here, I'm here, I'm here.
Are you, so would you suggest testing your children? I have a 5-year-old and a 3-year-old. That should you get ahead of this stuff so you know what's coming?
Perfect world, yes. Perfect world, absolutely. Like I have a daughter, I have granddaughters, yes. Like, and just to have that knowledge, should we need it? Like I've had people say to me, so where do you see this going? I'm like, I'd love to see it just like a CBC, a complete blood count. Go to your PCP for your yearly visit. Let's run some blood, right? This you only have to do one time because the DNA is going to remain the same. It's the expression of it that changes. So to know what your strengths are, what your weaknesses are, and we all have them. Everybody on the face of the earth has strengths and weaknesses. So knowing what they are beforehand, so we're like, okay, you're talking to a young kid, you're probably going to be in a situation with your buddies where they're going to say, hey, great idea, let's do this. I want to let you know it's going to affect you differently, right? So be armed with that information. You still get to make your decision, but you're not going to be a one and done.
Yeah, you have the knowledge at least.
Exactly.
I know that like with marijuana, some people have a predisposition for schizophrenia. And so if they smoke early, if you knew that going into it, we didn't know that growing up, but if we knew that, maybe my brother who, had some mental health challenges later on in his middle ages because he smoked a lot when he was younger, and our family unfortunately has kind of that predisposition. So, So what type of, you're testing people, you're helping them, but how are you helping them?
Okay, so great question. So we, you do a buccal swab, we get the results, we go over each one of those. We look at 85 different biomarkers. We go over each single one, what it means. And then if we need to optimize it, how are we going to do that? So that could be through supplements, that could be through pharmaceuticals, that could be through lifestyle changes. Like we could look at your DNA and say, for you, intermittent fasting is going to be really good in a 12 to 15 hour window. For the next person, not so much. They don't need to be doing that. Just kind of things like that of what's going to play out. We may see that you've got all of these polymorphisms when it comes to, say, mold, or that, for example, you have mental health challenges and you've been on an SSRI or an antidepressant and you've gotten nowhere. It's one of the genes that we look at tells us about the efficacy for an SSRI for you. So, just that particular gene is so important for people because, I mean, we see people that have been on SSRIs for decades. First off, they were never meant for that. They were meant for what we call an acute situation. Life happens. It's not good. I need a little bit of help. Here you go. Not meant to live on these things, which is how they're now prescribed. Just stay on it, keep going. So we'll see somebody who's like, yeah, I've been on a slew of SSRIs for decades, and still their serotonin is in the tank. So I'm like, that was never going to work for you. No one took a deeper dive to see, okay, you've got this particular polymorphism. It's not going to be effective. We've got to figure out a different way for you to improve upon, for example, that serotonin. So it really looks at the unique individual and treats you as such and says, okay, what do we need to do for you?
So I'm kind of curious. I assume you haven't listened to any of my podcasts because you're a busy lady, but so I was on all these SSRIs and everything and nothing helped. And so I suffered from PTSD, anxiety, depression. It goes on and on and on for 20 years and nothing worked. So I last year went down and did ayahuasca and and it was a light switch. I mean, it changed my life immediately. And but I don't know the medical reasons behind that. And have you worked with anybody who's ever experimented or done any of those?
I know of one of our patients who has, and interestingly enough, a combat vet as well, got good results, didn't seem to last. So kind of my thing with ayahuasca or whatever it is, even medical marijuana, is let's look at your particular DNA and see if it's going to be effective for you, because someone else could also have a really bad reaction. And, much like your brother with marijuana, right? And somebody else is like, no, man, this is what helps me. It's like, this guy, no good.
Yeah, totally.
So we should know that, right? We should know that going into it. What's going to be most beneficial for you? Is this going to work? The neurotransmitters typically involved, GABA, glutamate, right? That acts like a seesaw. Serotonin, dopamine, that acts like a seesaw. So we need to know what are your results, what's going on physiologically within your body to say this is the best route of probability of what could help you. So has it for you?
Yeah. Well, I've been down there multiple times in the last year. I've actually been down there 3 different times, and it wasn't because it wore off. It's just I got a lot of enlightenment, I guess, as far as like who I am and wanting to do better and help other people and help other vets. And that's why I started this whole podcast, is because of that experience. So yeah, I mean, it was a complete night and day, changed my life. And so, but I don't think that it is for everybody. And it's different. But so on the genetics, I've done like 23andMe, and they basically only thing they told me was, oh, you have a predisposition for celiac disease. And that was about it. When you're testing people, are they getting results that they can take with them and keep? Because boy, I forget things after a few months. I'm like, what'd she tell me?
Yeah, no, absolutely. You get a whole report. But something like 23andMe, that's what we would call a recreational lab test. We do a clinical lab test. And the problem with like a 23andMe is, for example, people say, well, I did 23andMe and I'm good on this, that, and that, the other thing. Like, okay, let's just use the example of methylation because there's so much chatter about that on the internet, right? So they'll look at a handful of methylation genes. We look at 14 genes related to methylation because it's such a complex cycle. And it could be very misleading information. It could say, well, you don't have the MTHFR gene, so you're good to go. When that is not true at all, because there's a lot of other genes that play into that. So that information can become somewhat misleading, but beyond that is, okay, so now that we know that, what are we going to do about it? And that's where that's the focus of what our company does, though. What are we going to do about it? We've isolated, identified, and measured. And now that we've done that, what are we going to do to improve upon that? And just like everyone being unique with no two people having the exact same DNA, so is the results for you and the recommendations. They're unique to you and your lab results, not somebody else's, not spit out, this is for everybody, here you go. So it really goes into, as I said, the physiological part of it and then the lifestyle part of it. But even lifestyle, you can't say the same things for everybody. They're not going to, for somebody, it could be a negative experience. For someone else, it could be a really good thing.
Mm-hmm. So are your clients, are they coming to you in clinic, or are they online? How can people get a hold of you if they want to sign up with you and start
Sure.
down this road?
Sure. So we work with people literally all over the world. When we finish here, Tim, I have a client from Australia that I'll be having a meeting with. But we see people all over the world, and we meet virtually. We drop ship the lab kits to you, do your samples at home, send them back to the lab. We get the results. We create that biomarker evaluation report, very extensive. Then we have a meeting just like this, typically like an hour and a half, to go over each one of those items in there, each one of those individual biomarkers. What does it mean? If we have, for example, a heterozygous result versus a homozygous result, meaning one of the genes in the pair is affected or both in the genes of the pair are affected, we really dive deep into then how are we going to optimize this. And then either people take all that information and say, I'm disciplined enough where I can do this on my own. Or some people say, I really want to work with you. Well, let's start. And I need that check-in with somebody, and how are you doing, kind of thing. So we really make it available to whatever works best for the individual.
Do you find, is there an age range where it seems to work better for some people than others? Like if you start too late in life or too early in life, is it all pretty consistent?
The youngest we've ever had was 2, and the oldest 97, I believe, mid to high 90s. I think it was 97. So it really runs a gamut, because everybody's different. Let's see what we're working with.
97, that's impressive. They're still getting after it and trying to better their life. Good for them.
Exactly.
That's cool. So I mean, I'm interested. You've got me sold, basically, and that's why you're here. So I'm gonna jump on your website afterwards. Is that how you sign up? You just go on your website?
Yeah. So wiredbiohealth.com, Wired BioHealth, and go on there. You can sign up for a 15-minute complimentary consultation to speak with me or one of our wellness consultants or clinicians. So we know what's particular for you, what's going on with you. Here's what I would suggest. And then we drop ship the lab kit to you, you do it, and we get started. One of the other labs that we do, we don't have a patent on this, but what we do is a pharmacogenomic test. What that does is looks at your individual DNA and says, is a pharmaceutical going to be safe, cautionary, or not to be used at all? Right? It was kind of oversold some 15, 20 years ago, saying it's going to tell you what drug you should take. No, it's going to tell you, will you have an adverse effect? But that's important information. And again, it's a one-time thing. So, before, let's say something happens in your life, you wind up in the emergency room of a hospital, like you should know what would be, can't ever take this. Not just, are you allergic to sulfa, blah, 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 right? But is there anything that you're going to have an adverse effect to that we would possibly prescribe for you? So there's so much now that's available diagnostically in the mental health world, in the addiction world, that was not available before. It was this mentality of you got yourself there, get yourself out.
Mm-hmm.
Right? And we weren't treating it like healthcare.
Mm-hmm.
We were treating it like, yeah, I don't think so. Right? Let's put you in timeout. And that's not the case at all. There's no moral failing in anyone. This is how you're made up. And we're all different and unique. And that's great that we are. Right? But we need to know what we're made up of to have the most successful life. It just
Yeah.
makes sense.
Yeah, absolutely. I mean, you have a predisposition for alcoholism. You are kind of testing for some of that stuff, and you can kind of identify those things early on.
Yeah, yeah. I mean, like one of the mental health genes that we'll look at, say the GAD1 gene, glutamic acid decarboxylase. That's responsible for converting glutamic acid, which is a stimulant neurotransmitter, to GABA, which is a calming neurotransmitter. So if you have a polymorphism here, one of the genes, both of the genes in this particular GAD1 gene, that's why you never get to the calm. So, someone is like, damn, just do this, you're like, I'm doing it all and it's not working.
Yeah.
Right? We identify, what that can do? Well, you probably do. What that can do to someone emotionally. It's like, oh my gosh, I wasn't just trying to be in my own way and keep my life messed up. There's actually something that makes total sense about why I react the way I do, why things play out the way they do in my life. And most importantly, it can be changed. That's the whole thing.
Yeah, that's the thing. Because for me, it was 20 years. Like,
Yeah.
try. And my doctor even gave me GABA, and I took it, and I'm like, oh, I feel warm, but nothing else has changed. And
Yeah.
um, so
I can't tell you the amount of people that would do a lab test and their GABA is through the roof.
yeah,
They are not feeling any better and a lot of times feeling worse. I'm like, what's going on? Well, I read or my so-and-so told me to take this. I'm like, no, just
yeah,
because something's over the counter doesn't mean it doesn't have a biochemical effect in your body. It will change your physiology. So we have to know if it's appropriate for you and if it's going to work for you. Not just like, well, I read this in People magazine and it seems like a good thing, so I'll take some. No,
yeah.
it changes physiology.
That was me. I literally opened up my medicine cabinet, and it's every
Yeah.
vitamin you could think of, and it's like, I'm just going to try it, see if it helps. And it didn't help,
Right.
but diet,
And
exercise, and
yeah,
some of these other things that you're prescribing do
yeah,
help.
yeah. And again, it's not for lack of trying,
Yeah. Yeah.
it's just not knowing the direction to go in.
Nice. Well, what am I missing? Anything?
No, this is a great conversation, Tim. I mean, I really appreciate in your work. It's very important what you're doing. And people listen to what you say,
Yeah.
like you being a combat vet, PTSD. It's like trauma, because trauma is such a buzzword today. There's the big T's, there's a little T's. No one gets out of this life without trauma. It's
Yeah.
what did it do to you individually? Some people are resilient, some people aren't. How does that happen, right? But the most important thing is to understand that trauma is more than just a word to quantify a negative experience. It actually changes your
Hmm.
physiology.
Hmm.
So we need to know what your starting point is to say, how are we going to optimize someone if we don't even know where they are right now?
Hmm.
It's no different than saying, try this antidepressant. If it doesn't work, we'll try you on this one and then we'll double it. It's no different. You're doing the exact same thing.
Yeah, it's interesting. Like some people, I mean, I had all kinds of different traumas, like everybody. And but some of the guys I served with, no problem. Others are just completely wrecked. And I'm like, man, they saw less combat than, me, or and so it's amazing how everybody's totally different and how they respond to trauma or addiction or any of these things.
Absolutely.
So
Absolutely.
the fact
Yep.
that you're narrowing it down gives me hope. There's a lot of people that need like an answer.
Right. Yeah. And that's really what I hope it does. Conversations like this is say, you know what? There's actually hope here. This can change. That's the biggest walkaway, not just like, okay, here's your results. Thank you for
Yeah.
playing. It's like, okay, let's change it.
Yeah.
That's when it gets really good.
Yeah, and people who are signing up with you, I assume, have tried a lot of things and they're willing to change, but it's hard.
Absolutely.
There's so many people out there who need the help, and they're not willing to take those steps, and we're surrounded by them. I'm surrounded by them, and it's like, how
Yeah.
do you have any wise words of wisdom to if you know somebody's struggling and they need to get help, like how would you kind of encourage them to start down this road?
One of the big things, Tim, for somebody like you're describing, or really anybody, is it takes the pressure off of you in a moral failing. And it's like, no, man, we're all wired differently.
Mhm.
So we can find out why you act out the way you do. It doesn't have to do, it becomes your responsibility when you know better and you
Mhm.
continue to do the same thing. But if you have no clue and you're trying, it really takes the pressure off of somebody's like, wow, you know what? Yeah, we all, like I said, we all have strengths, we all have weaknesses. Like, let's identify what those weaknesses are so we can then do a course correction
Mhm.
of where we're at. So I think that part of it destigmatizes, takes all the putting somebody in timeout in the corner. You just want to be this way. Nothing could be further than the truth. And the advancement of science that has allowed us to do what we do and look at what we look at is really a game changer for people. And it should offer hope because you don't have to sit in that pain.
Mhm. I have a nephew, and I don't like to drop names or anything, but he he was adopted, and at 3 years old, and he has been just a hot mess.
Yep.
And my poor brother-in-law has been trying to work with him, and he's working with doctors, and they got him on all of these freaking medications. And to me, I'm like, maybe you should just stop all of them
Mhm.
and see what his baseline is. I mean, and they're like, oh no, we've stopped it for a couple weeks and stuff like that. And so I'm gonna send him to you because I think he needs to
Of-
test, like, what's his baseline, what's his genetics.
Exactly.
They don't have any idea.
One of the best cases, I actually presented this in Abu Dhabi, the International Substance Use Conference, was a child who was adopted, foster first, then adopted, born neonatal alcohol syndrome. Mom was addicted to several different um, drugs. And by the time this child was in pre-K, had already been kicked out of 3 schools.
Hmm.
Parents came to us, it's interrupting our family. It's every day a call from school. It's, not what we signed up for at all. Beyond that, the kid obviously is in pain. Like, let's do this. We did. And she actually just makes me smile. She actually won the Character of the Year award at the end of school. The
Wow.
change in this kid was unbelievable. And, someone that early in their life, 6 years old at the time, you're already living that life. How many other lives are you going to impact? Because
Yeah.
you're only 6. You've got a lot
Yeah.
longer than I do, right? So the value of that for her life, for her family's life, because the other siblings were like, hey, we're not liking this,
Yeah.
And to be kicked out of school, then what happens? The kid starts to own that label.
Yeah.
I'm the troublemaker. I'm the bad guy. I'm the this. I'm the girl who's always going to have a problem. So let me show them what a problem looks like, right? They
Mhm.
start to live out that identity because they're being told constantly this is who they are.
Yep. That's exactly what's going on right now. And I know my brother-in-law watches this, but the kid talks to me and he's like, yeah, well, I'm disabled. I'm like, dude, you're 12 years old. You're 13 years old. You just, I know people have mental health challenges and stuff like that, but I just don't feel like it's being addressed, like the way that's going to help him. And so
Right.
I might have to chop this part out, but I don't want to. I mean, this kid,
No, it might really
you
be
got
good.
2 clients now.
It might really be good because otherwise you have no, like with my husband, had no idea of what any health history was. So
Yeah.
that alone is really important. Like one of the categories that we look at is inflammatory markers. And there's quite extensive, I think like 13 or 16 of them, because it's so important to every disease process,
Hmm.
right? And he died at 42 from cancer. So how
Wow.
important is it for us to know that for my daughter?
Hmm.
Right? So it's not just the mental health, just the addiction, it's the overall package. One of the other categories we look at is something called autophagy. Autophagy was only, we've known about it for better than 50 years, but the cellular interaction of what's happening with autophagy was only 2016 that a Japanese physician won the Nobel Prize for understanding this. We look at those particular genes. It's kind of like the garbage man of your cells. Every day cells die off. That's normal. They're supposed to. They have to have a way to get out of your body. If they're not exiting out of the person's body, that garbage is literally building up inside of you. You feel horrible. And that's how conditions and diseases begin. So the information is beyond valuable for somebody.
So I have a friend who's a vet, and he has, stage 4 melanoma. I mean, he's battling cancer, and I mean, he's doing his best, and he had some operations, and he's hanging in there. If Would this be beneficial for him to know some of this stuff?
Yeah. Yes.
Yeah, yeah.
Yes. Because, if you're not detoxifying, if you're not getting rid of all that, it's just going to exacerbate and compound everything that's going on.
Hmm.
Yep.
Yeah. All right. So now we're up to 3. Jeez. You're hitting a home run today. I like
No,
it.
you are. You are. You're the guy who's asking the right questions because you're putting the pieces together like, my gosh, it seems like everybody should do that. Yes, everybody
Yeah.
should,
Yeah.
right?
Absolutely. Man, um, we're about, well, we're only 30 minutes into this, but I don't want to take up your entire day.
It's been
Is
great.
there anything else I'm missing, or if people want to get a hold of you and plug
Sure.
away?
Yeah. So go to our website, wiredbiohealth.com. Take a look through there, even sign up for a consultation, complimentary. Like, is this for me? Here's what's going on with me. Here's my particulars, what we would suggest you do. Yeah, like take advantage of it.
Mhm.
Take advantage of it. If it's particular to an addiction, wiredforaddiction.com. But either way, whatever it is you need, like really it's information that is so valuable for each and every one of us to understand to first off live the best life that we can with what we've got. And then perfect world is to prevent so much that really is preventable. So
Awesome.
yeah, that's the way to go. And at the end of it, it's like this thing we've been giving of a life is supposed to be a gift. It's like do the things that we can to play it out as a gift as much as we can. And this would be one of those things, it can be the difference of you are trying to walk uphill all day, every day versus, you know what? Whoa, this is a different feeling.
Yeah, absolutely. Well, I sure appreciate what you're doing. I mean, your bio is incredible. You did TED Talks, that's super impressive, and all these other things that you have. You have books out there, and I thank you so much for taking the time to chat with me, and I really appreciate it.
Thank you, Tim, and thank you for doing your podcast. I mean, that's what people listen to. It's what matters. So thank you for the work that you do.
Absolutely. Thank you.